Hi, in this vlog I'd like to talk about fetal movements. Very important topic. When can a woman expect to experience the baby moving for the first time? Well, the baby's moving well before the woman is aware of it. The ultrasound scans I'm doing at 6-8 weeks pregnancy, you can see the baby moving, but certainly the woman is not aware of her baby moving inside her. Usually in the first pregnancy, ongoing pregnancy, she's not aware of movements till about 20 weeks roughly. Now, if the placenta is anterior, it acts like a cushion, so she may not be aware of movements until even after that. In subsequent ongoing pregnancy, she's aware of movements sooner than that, and the reason is because she knows what she's feeling. First time around, she doesn't know, she doesn't recognize it as movements. It's initially described as butterfly, funny wind. There's something unusual that keeps on happening. That's the baby moving. But second time round, she knows exactly what it is, so she will comment to me, my patient will comment that I'm aware of the baby moving at this stage, even though she's well under 20 weeks. Now, initially it's just an awareness, so don't be concerned. When we get worried at 20 weeks, I can't feel my baby moving, is everything okay? Don't be concerned, because as the baby gets bigger, the movements get stronger and they become more aware for you and also for your partner to feel when they're feeling your tummy. So there's a gradual increase. And how much babies move will vary. I remember when my sister was pregnant with twins, one twin was far more active than the other twin. And when the twins were born, the one that was more active on the inside was also more active on the outside. So they're starting to develop their own personalities already in your womb. So you understand your baby's normal level of activity. Some will be very active and some won't be very active. Don't worry, as long as it's in that same pattern, everything should be okay. So just relax. Now, but if you're going from the baby being very active to being very quiet, that's a point of concern. That's a point of concern. We expect going into that third trimester and beyond, the baby to be moving at least 10 times every 12 hours. So it could be just bang, bang, bang. It's 10 kicks every 12 hours is what we expect going into the more advanced pregnancy. If it's less than that, you need to contact the hospital. So if you're worried that the baby's movements have dropped off, you're worried that you can't feel the baby moving at all, whereas you could feel it moving quite well yesterday, you're worried about anything like that, then the first thing you need to do is to give the birth or birthing unit a call, and the midwives will advise you to attend. They'll put the baby monitor on your abdomen, and we can check the baby's well-being very, very easily. Now, usually we look at the baby's heart rate pattern and reassure you it's not unusual for a woman to comment when she's on the trace, I can now feel my baby moving. Now, the other thing you can do just before you go to the hospital is maybe have a more sugary drink, increase your sugar load a bit, because that will make you more aware. The other thing is to rest, because often that lack of awareness is not because the baby's moving any less or any concerns, it's simply because you've been so busy with life, so busy with work. And if you take time just to lie down for a spell and just focus on the baby, have an orange juice or something and focus on the baby, and often you become aware, the baby's moving okay. As you get right at the end of the pregnancy, the character of the movements change. That's because it's very cramped inside. So it goes from baby doing more of a kicking movement to more of a rolling movement because it's so cramped. So the character of the movement changes in that last month. That doesn't mean there's any problem. It just means that your baby has grown quite well during the course of the pregnancy. But certainly any concerns about baby's movements, feel free to contact me if you're my patient, and certainly you contact the hospital, the midwives, and they can take it from there and decide if everything's okay. Hope that information helps, and look forward to speaking to you again soon. Bye for now.